Oatmeal turns harmful for seniors when mixed with these 7 common foods. At 72 years old, Martha collapsed in her kitchen after her healthy breakfast. The doctors were baffled until they discovered what she'd been mixing with her daily oatmeal for months. This seemingly harmless combination had been silently wreaking havoc on her body. If you're over 60 and eat oatmeal regularly, you need to know about these 7 dangerous food combinations that could be putting your health at serious risk. Some of these might shock you, especially number 4, which 80% of seniors do without realizing the consequences. Stay with me because what you learn in the next few minutes could literally save your life. Meet Martha, a vibrant 72-year-old retired teacher from Portland who prided herself on eating healthy. Every morning for 3 years, she enjoyed her steel-cut oats with what she thought were nutritious additions. Martha walked daily, took her vitamins, and followed her doctor's advice religiously. But something was slowly poisoning her system. The morning it happened, Martha prepared her usual breakfast, oatmeal topped with her favourite healthy ingredients. Within 2 hours she experienced severe stomach cramps, dizziness and difficulty breathing. At the hospital, doctors ran extensive tests, confused by her symptoms. It wasn't until a nutritionist reviewed Martha's daily routine that the shocking truth emerged. The foods Martha was combining with her oatmeal were creating dangerous interactions in her aging digestive system. What's terrifying is that millions of seniors are making these same mistakes right now. Before we reveal what nearly killed Martha, I want you to think about your own breakfast routine. Have you been making any of these combinations? Drop a comment below and tell us what you typically add to your oatmeal. You might be surprised by what you discover today. And if this information helps you, please share it with someone you care about because this could save lives. All right, folks, let's talk about the first dangerous combination that's harming seniors. It's mixing oatmeal with citrus fruits like oranges, grapefruits, or even that morning glass of orange juice you drink alongside your breakfast. So here's what happens in your body. As we age, our stomach acid production naturally decreases by up to 40%. When you combine oatmeal's high fiber content with the intense acidity of citrus fruits, it creates a perfect storm in your digestive system. The citric acid interferes with your body's ability to absorb the iron and calcium from the oats, while the fiber binds with essential minerals, literally flushing them out of your system. But here's the really dangerous part. This combination can trigger severe acid reflux in seniors, leading to aspiration pneumonia. Dr. Jennifer Walsh from the American Geriatric Society explains that when acid reflux occurs in older adults, stomach contents can enter the lungs, causing life-threatening infections. Now, let's take 68-year-old Frank from Michigan. He loved adding fresh orange slices to his oatmeal every morning. After 6 months, he developed chronic fatigue, brittle bones, and recurring respiratory infections. His doctor discovered Frank had developed severe mineral deficiencies and early-stage aspiration damage to his lungs, all from this innocent breakfast combination. The citrus oatmeal combination also spikes your blood sugar dangerously. While oats have a low glycemic index, citrus fruits cause rapid glucose absorption when combined with fiber-rich foods in seniors. This creates blood sugar roller coasters that can trigger diabetic episodes or hyperglycemic crashes hours later. What should you do instead? If you love citrus flavors, wait at least 2 hours after eating oatmeal before consuming citrus fruits. Better yet, add a small amount of lemon zest, not juice, to your oats for flavor without the dangerous acid content. Your body will thank you, and you'll actually absorb the nutrients your oats provide. Have you been combining citrus with your oats? The next combination is even more shocking. Number 2, dairy products and calcium-rich foods. The second dangerous combination that's silently harming millions of seniors is adding dairy products like milk, yogurt or cheese to your oatmeal. This might sound crazy since we've been told dairy and oats are healthy, but here's the hidden danger. As we age past 60, our bodies produce significantly less lactase, the enzyme needed to digest dairy. When you combine dairy with oat fiber, it creates an inflammatory response in your intestinal lining. This inflammation doesn't just cause digestive discomfort. It actively blocks the absorption of magnesium and phosphorus, two minerals crucial for preventing osteoporosis and heart disease in seniors. The real danger lies in something called calcium blocking. Oats contain compounds called phytates that bind with the calcium in dairy, forming insoluble complexes your body can't use. You think you're getting calcium for your bones, but you're actually creating calcium deposits in your arteries instead. This process, called vascular calcification, is a leading cause of heart attacks in people over 65. Consider Ruth, a 74-year-old grandmother from Texas who religiously ate oatmeal with whole milk every morning, believing it would strengthen her bones. After 2 years, her bone density scan showed severe osteoporosis, and she developed dangerous calcium buildup in her coronary arteries. Her cardiologist was puzzled. Ruth's diet seemed perfect on paper. The combination becomes even more dangerous when you add yogurt to oats. The probiotics in yogurt, while beneficial alone, compete with your body's ability to process the complex carbohydrates in oats. This creates excessive gas production and can lead to small intestinal bacterial overgrowth, a serious condition that affects 15% of seniors and can cause malnutrition. Here's what happens in your digestive system. The dairy proteins cause the oat fiber to ferment improperly, producing toxic compounds that inflame your gut lining. Over time, this chronic inflammation can lead to leaky gut syndrome, allowing harmful bacteria to enter your bloodstream. The solution? Use plant-based milk alternatives like unsweetened almond milk or oat milk with your oatmeal. These provide creaminess without the dangerous interactions. Or better yet, cook your oats with water and add flavor with safe spices. But wait until you hear about the third combination. It's in 90% of senior kitchens. Number 3. Iron-rich foods and supplements. The third deadly combination that's putting seniors at risk is mixing oatmeal with iron-rich foods or taking iron supplements with your morning oats. This combination is particularly dangerous because many seniors are prescribed iron supplements for anemia, not realizing they're creating a toxic situation. Here's the shocking truth. Oats contain high levels of phytic acid which binds with iron to form insoluble compounds your body cannot absorb. But that's not the worst part. When iron becomes bound to fiber in your digestive system, it oxidizes, creating harmful free radicals that damage your intestinal lining and can lead to colorectal cancer. Dr. Michael Henderson from Johns Hopkins found that seniors who regularly consume iron with high-fiber foods show 60% higher rates of oxidative stress markers in their blood. This oxidative stress accelerates aging and increases risk of heart disease, stroke, and cognitive decline. Meet 69-year-old Carl from Florida, a retired mechanic who took iron supplements with his morning oatmeal after being diagnosed with mild anemia. Within 8 months, Carl developed severe abdominal pain, chronic fatigue, and concerning changes in his stool. Tests revealed dangerous iron accumulation in his liver and signs of oxidative damage throughout his digestive system. The iron-oat combination creates another hidden danger. It disrupts zinc absorption. Zinc is crucial for immune function in seniors, and deficiency leads to increased susceptibility to infections, slower wound healing, and loss of taste and smell. Many seniors who think they're boosting their iron are actually creating zinc deficiency, weakening their immune systems when they need them most. But here's the most dangerous aspect. Excess iron in seniors can trigger something called iron overload syndrome. Unlike younger people, seniors don't efficiently eliminate excess iron. When combined with oat fiber, iron accumulates in organs, particularly the heart and liver, leading to organ failure. The bound iron fiber complex also feeds harmful bacteria in your gut while starving beneficial bacteria. This creates dysbiosis, an imbalanced gut microbiome that's linked to depression, cognitive decline, and increased inflammation throughout your body. What's the safe approach? If you need iron supplementation, take it at least 4 hours away from fiber-rich meals. Better yet, get iron from easily absorbed sources like organic spinach or grass-fed beef, consumed separately from your oats. Always consult your doctor about iron supplementation timing. The fourth combination is even more shocking because it's something 80% of seniors do daily. Number 4, coffee and caffeine-based beverages. The fourth dangerous combination that 80% of seniors unknowingly practice is drinking coffee with their oatmeal breakfast. This seems harmless, even healthy, but it's creating serious health problems for older adults. Here's what happens in your aging body. Coffee contains compounds called tannins that bind with the protein and minerals in oats, forming complexes that your body treats as toxins. Your liver has to work overtime to process these bound compounds, putting stress on an organ that's already working harder as you age. The caffeine in coffee also interferes with your body's ability to regulate blood sugar after eating oats. While oats normally provide steady energy, caffeine causes rapid glucose spikes followed by dangerous crashes. For seniors with prediabetes or diabetes, this combination can trigger hyperglycemic episodes that damage blood vessels and organs. But here's the most dangerous part. The coffee-oat combination severely impacts medication absorption. Many seniors take morning medications with their breakfast, not realizing that coffee and fiber together can reduce medication effectiveness by up to 50%. Heart medications, blood pressure pills, and diabetes medications become significantly less effective. Consider 71-year-old Betty from Ohio, who enjoyed her morning routine of oatmeal and black coffee for over a decade. Despite taking her prescribed medications religiously, her blood pressure remained dangerously high, and her cholesterol levels worsened. Her doctor increased her medications multiple times with little improvement. It wasn't until Betty mentioned her breakfast routine during a detailed consultation that the connection became clear. The tannins in coffee bind with the fiber in oats, creating a barrier in your intestines that blocks nutrient absorption. Essential B vitamins, magnesium and potassium, all crucial for heart health in seniors, get flushed out of your system instead of being absorbed. This creates deficiencies that can lead to heart rhythm problems, muscle weakness and cognitive decline. Coffee with oats also increases cortisol production in seniors, whose stress hormone systems are already more sensitive. Elevated cortisol leads to chronic inflammation, weakened immune function and accelerated bone loss. Many seniors experiencing unexplained anxiety, sleep problems or bone fractures are unknowingly suffering from chronic cortisol elevation. The combination also dehydrates seniors more severely than in younger people. Dehydration in older adults can quickly become life-threatening, leading to kidney problems, blood clots, and falls due to dizziness. Safe alternatives: try herbal teas like chamomile or ginger with your oats, or drink your coffee at least 2 hours after eating. Your body will absorb nutrients properly, and your medications will work as intended. The fifth combination involves something most seniors consider a superfood. Number 5. High-fiber fruits and vegetables. The fifth dangerous combination that's harming seniors is adding high-fiber fruits and vegetables like apples, pears, broccoli or Brussels sprouts to meals containing oatmeal. This combination creates what nutritionists call fiber overload syndrome, and it's particularly dangerous for aging digestive systems. Here's the hidden danger. When you combine oat fiber with additional high-fiber foods, you create an indigestible mass in your intestines. Senior digestive systems produce less stomach acid and digestive enzymes, making it nearly impossible to break down this fiber combination. The result? Dangerous intestinal blockages that can require emergency surgery. Dr. Sarah Martinez from the American Gastroenterology Association reports a 300% increase in fiber-related blockages among seniors over the past decade. Most cases involve people trying to eat healthier by combining multiple fiber sources in single meals. Take 66-year-old Vincent from Arizona, a health-conscious retiree who added shredded apple and steamed broccoli to his morning oatmeal, believing more fiber meant better health. Within 3 weeks, Vincent experienced severe abdominal pain, bloating and constipation. Emergency room doctors discovered a dangerous fecal impaction that required immediate intervention to prevent intestinal rupture. The excessive fiber combination also creates malabsorption syndrome in seniors. When fiber intake exceeds your body's processing capacity, it binds with essential nutrients and medications, carrying them out of your system before absorption. Seniors eating high-fiber combinations often develop deficiencies in fat-soluble vitamins A, D, E, and K, leading to vision problems, bone loss, and bleeding disorders. But here's the most shocking aspect. The fiber overload feeds harmful bacteria while starving beneficial gut bacteria. This creates toxic fermentation, producing gases like methane and hydrogen sulfide that damage your intestinal lining. Many seniors experiencing chronic fatigue, brain fog, and unexplained mood changes are suffering from toxic bacterial overgrowth caused by excessive fiber combinations. The bound fiber mass also interferes with water absorption in your colon, leading to dangerous dehydration despite drinking adequate fluids. You know, dehydration in seniors can cause kidney damage, blood clots, and an increased fall risk due to dizziness and confusion. High fiber combinations also trigger diverticulitis attacks in seniors with diverticular disease, a condition affecting 50% of people over 60. The indigestible fiber mass gets trapped in intestinal pockets, causing dangerous infections that can lead to perforation and sepsis. So what's the smart solution? Well, space out your fiber intake throughout the day. If you eat oatmeal for breakfast, choose low-fiber options for the rest of your morning meals. Add 1 piece of fruit or vegetable per meal, never multiple sources together. This way, your digestive system will process nutrients efficiently without dangerous overload. The sixth combination involves something that seems incredibly healthy, but creates a perfect storm in senior bodies. Number 6, nuts, seeds, and protein-rich foods. The sixth dangerous combination that's silently harming seniors is adding nuts, seeds, or high-protein foods like eggs or protein powder to your oatmeal. This combination seems like the perfect healthy breakfast, but it's creating serious metabolic problems in aging bodies. Here's the critical issue. As we age, our digestive enzymes decrease significantly. Combining oat fiber with protein and fats from nuts creates an incredibly difficult to digest mixture that sits in your stomach for hours, fermenting and producing toxic compounds. This process, called putrefaction, creates harmful bacteria overgrowth and inflammatory toxins that enter your bloodstream. The protein-fiber combination also triggers dangerous insulin spikes in seniors. While oats alone have a low glycemic index, adding protein causes your body to release both insulin and glucagon simultaneously, creating metabolic confusion. This leads to insulin resistance, the precursor to type 2 diabetes, which affects 26% of seniors. Consider 73-year-old Patricia from Washington, who added almonds and a boiled egg to her daily oatmeal, believing she was creating the perfect balanced meal. Within 6 months, Patricia developed severe bloating, chronic fatigue, and pre-diabetic blood sugar levels. Her doctor was puzzled. Her individual food choices seemed healthy, but the combination was wreaking havoc on her metabolism. The nuts and seeds in this combination contain enzyme inhibitors that your aging digestive system can't neutralize effectively. These inhibitors block protein digestion, causing undigested proteins to putrefy in your intestines. The resulting toxins, called polyamines, are linked to increased cancer risk and accelerated aging. But here's the most dangerous aspect. The combination creates kidney stress in seniors. Your kidneys have to work overtime to filter the protein waste products while dealing with the bound minerals from the fiber-protein complex. Many seniors unknowingly develop chronic kidney disease from these healthy breakfast combinations. The fiber-protein-fat combination also severely impairs nutrient absorption. Essential amino acids get bound to fiber and eliminated before your muscles can use them. This leads to sarcopenia, age-related muscle loss, despite eating protein. Many seniors, wondering why they're losing strength despite eating enough protein, are suffering from this absorption problem. The mixture also creates dangerous gas production as undigested proteins ferment. This isn't just uncomfortable. The gases include toxic compounds like hydrogen sulfide and ammonia that damage your intestinal lining and can enter your bloodstream, affecting brain function and mood. Safe approach: eat your protein sources 2 to 3 hours away from fiber-rich meals. If you want nuts with breakfast, have a small handful after your oatmeal has digested, not mixed together. Your body will properly utilize both the protein and the fiber nutrients. But the seventh combination is the most shocking because it's actually prescribed by many doctors. Number 7. Medications and supplements. The seventh and most dangerous combination that doctors rarely warn seniors about is taking medications or supplements with your oatmeal breakfast. This practice is putting millions of seniors at serious risk because the fiber in oats can reduce medication effectiveness by up to 75%. Here's the life-threatening reality. Oat fiber binds with many common senior medications, including blood thinners, heart medications, diabetes drugs, and blood pressure pills. When these medications get bound to fiber, they pass through your system without being absorbed, leaving you essentially unmedicated while thinking you're protected. Dr. Robert Chen from the Mayo Clinic documented cases where seniors experienced heart attacks, strokes, and diabetic emergencies because their medications were rendered ineffective by fiber interactions. The most dangerous part? These patients had no idea their healthy breakfast was sabotaging their life-saving medications. Meet 70-year-old George from Nevada, who took his morning warfarin, a blood thinner, with his oatmeal breakfast for 2 years. Despite taking his medication faithfully, George developed a massive stroke caused by blood clots. Hospital tests revealed his blood clotting levels were dangerously high. His warfarin wasn't working because the oat fiber was preventing absorption. The fiber medication combination creates another hidden danger. It can cause dangerous accumulation of certain drugs. Some medications that aren't absorbed immediately get released later in concentrated doses, causing toxic overdose effects hours after eating. This explains why some seniors experience unexplained medication side effects in the afternoon after morning oat consumption. Cholesterol medications are particularly affected by this combination. Statins bind to oat fiber and become ineffective, leaving seniors vulnerable to heart attacks while believing they're protected. Many seniors whose cholesterol remains high, despite medication compliance, are experiencing fiber interference. But here's the most shocking discovery. Oat fiber can actually increase the toxicity of certain medications. When drugs get partially bound to fiber, they create metabolites that are more toxic than the original medication. This process can cause liver damage, kidney problems, and dangerous drug reactions that doctors can't explain. The combination also affects supplement absorption. Calcium, iron, magnesium, and vitamin D supplements become virtually useless when taken with oat fiber. Many seniors taking supplements for bone health, anemia, or immune support are wasting money and remaining deficient because of fiber binding. Critical timing guidelines. Take all medications at least 2 hours before or 4 hours after eating oat-based meals. This window allows proper absorption without fiber interference. Always consult your pharmacist about medication timing. They understand drug-food interactions better than most doctors. For supplements, separate them from fiber-rich meals by at least 3 hours. Better yet, take supplements with low-fiber meals to ensure maximum absorption. This isn't just about effectiveness, it's about your life. Medication failure due to fiber interference is causing preventable deaths among seniors who think they're making healthy choices. Now let's see how Martha's story ends and what this means for your health. Remember Martha, the 72-year-old teacher whose healthy breakfast nearly killed her? Here's what was happening. Martha was combining oatmeal with orange juice, Greek yogurt, iron supplements with her coffee, almonds, and taking her heart medication immediately after breakfast. She was unknowingly creating a perfect storm of dangerous food interactions. After her collapse, Martha worked with a geriatric nutritionist to completely restructure her eating routine. She now eats plain oatmeal with a touch of cinnamon for breakfast, drinks her coffee 2 hours later, takes her medications on an empty stomach as prescribed, and enjoys her other favorite foods at properly spaced intervals throughout the day. The transformation was remarkable. Within 3 months, Martha's energy levels soared, her digestive issues disappeared, and her doctor was amazed at how well her medications were suddenly working. Her blood pressure stabilized, her chronic fatigue vanished, and she felt 20 years younger. Martha now walks 5 miles daily, has returned to volunteer teaching, and travels regularly with her grandchildren. She often says that learning about these dangerous food combinations literally saved her life and gave her back her vitality. The key insight? It's not about avoiding healthy foods, it's about eating them at the right times and in the right combinations for your aging body. Your digestive system at 60 plus works differently than it did at 30, and your food choices must reflect this reality. These 7 combinations might seem harmless, but they're silently undermining the health of millions of seniors. The good news? Now that you know the truth, you can make simple changes that will dramatically improve your health, energy, and medication effectiveness. If this information shocked you as much as it did Martha, please hit that like button right now and share this video with every senior you care about. These combinations are affecting millions of people who have no idea they're putting their health at risk. Drop a comment below telling us which of these combinations you've been doing. You might be surprised how many others share your experience. Your story could help save someone's life. Don't let another day pass putting your health at risk. Subscribe and ring that notification bell. Remember, knowledge is power, but only if you act on it. Your health is worth more than convenience. Make these changes today and start living the vibrant, healthy life you deserve. I'll see you in the next video.